Hi, I'm Melissa and I'm Head of Nursing here at Therapie Fertility. I'm just doing a little video today to show you a little bit more about what happens and what to expect on the day of egg collection. You've made it this far, you've done so well, and I know this is the day that's probably carried a lot of anxiety around it, especially if you've never had a procedure before. Let's take it step by step. So you're going to come into the clinic and you're going to come up to the upstairs. If you've been in for your scans, you've probably been going to the downstairs ultrasound suite, but you're going to come back upstairs to the main clinic. You're going to be checked in by one of our reception staff, and then they're going to ask you to pop into the pods behind me here and take a seat. So you're going to take a seat in one of the pods here. Now, normally you can avail of the lovely coffee, but you will be fasting, so remember, no coffee or water in this visit. One of the nursing team is going to come and collect you from the pods. They're going to bring you through to the recovery area, and I'm just going to bring you through there now. This is the recovery area, and you're going to come in here before the procedure as well. So you'll have a little area that you're going to be in for the morning of your procedure. So you and your partner, you come in here. You can bring obviously your belongings in with you. There's fob access, so things are safe in here, okay? When you come in, we're going to firstly ask you to get ready, changed into your gown, all right? The gown, very glamorous. Looks like this. Pop it on, ties at the back. Lots of people are very worried about that, but don't worry, the nurses will look after you with that. You're going to pop on a hairnet as well, and you're going to pop on some shoe covers. You're going to sit here for then just a few moments when the nurse comes in, and we've got some paperwork that we need to run through with you, okay? We're going to do just some normal observations. We're going to check your blood pressure. We're going to check your heart rate. We're going to check your oxygen saturations. We're going to ask you to pop onto the weighing scales as well. That's just because it's really important for us to make sure that we're getting the correct medication doses for your sedation. With the egg collection procedure, it is a sedated procedure, so your partner can't come through with you into the room, but please don't worry, when you're coming back for your embryo transfer, you're more than welcome to bring your partner into that, and we do love to see you coming in together for that. Once you're ready to go through for your procedure, a nurse is going to call you to bring you through to the room. You're going to walk through to that procedure, okay? So come with me and I'll show you where we're going. So this is our procedure room. Come on through. So as I said, you're going to walk into the procedure room. You're going to come round here, and we're going to ask you to come and take a seat on the end of the bed. You are going to pop your legs into the stirrups, and we do just pop these little straps over on both legs, and that's just to keep your legs in place during the procedure. When you come in here, there's going to be a doctor, there's going to be a nurse, and there'll either be a second member of the nursing team in here or one of the healthcare assistants who you've probably met at some point along your journey already. You can see the window through, that's into the lab, and you're going to meet the embryologist that will do your egg collection as well. We're going to do a name check. This is quite an important part of the process. So what you'll do is you'll have a doctor looking at your notes on the computer, you have the embryologist in the lab, and they're both going to call out your details. They're going to call out your partner's details if you're coming through the partner, and they're also going to just confirm the treatment type that you're doing. Once that's confirmed, you'll see lots of movement happening in the room. At that point, the doctor or one of the nurses is going to pop the cannula into your arm. It's not as horrendous as it sounds, okay? What they do is just a needle. The needle doesn't stay in your arm. Needle comes out, there's a little plastic tube that stays there, so it's not particularly uncomfortable. But what it means is that we can give you the IV medication. Once you've had that, the doctor's going to give you your medication, and that is going to make you feel much more relaxed very quickly. We should talk about the sedation and how you're going to feel when you have that. The sedation and how it affects people is completely different for each individual. Some people are going to be fully asleep, and the next person might be quite awake and entertaining us all with their chats. For most people, the important thing is that when you go back through to recovery, you've kind of forgotten about it. There's a bit of an amnesia effect with the drugs. If you are still feeling a little bit uncomfortable, then we're going to give you some more medication, okay? We also give some IV paracetamol just for pain relief, which is very good as well. Once we're happy that you're nice and comfortable, the egg collection is going to begin. The egg collection is carried out by one of the consultants. So as I said, there'll be a consultant and also a member of the nursing team who will be at the foot of the bed, and they will be carrying out the procedure. What happens is we do it via an ultrasound, so like the scans that you've had during your stimulation, but there's a needle that's attached to that scan probe, and we just aspirate the fluid from the follicles. We aspirate them into these little test tubes, and these are just passed through that little window there into the lab, and they look at that fluid there and then, and they've got a good idea of how many eggs we've collected by the time the procedure is finished then. So after the procedure, we are going to bring you back through to the room that you started off in. You're going to be wheeled back in the bed, okay, because obviously you've had your sedation. Partners providing a sperm sample for part of this treatment. They'll then be called by one of the nursing team and brought through to the rooms to produce a sample. When you come back through from the procedure, there'll be a nurse there who's going to closely monitor your observations for the next 15 minutes to half an hour. Keeping an eye on your blood pressure, your heart rate, your breathing. Once you are a little bit more awake, we're going to offer you something to drink. We'll give you some water, something to eat. We are going to ask you to go to the bathroom because we want you to pass urine. And once we're happy that all of that's okay, and the doctor has seen you, had a chat with you, we're going to take that cannula out of your arm, and that's really the final steps just before you're ready to go home. When we discharge you home, you will have written information that's been sent to your portal. So that's there for you to review. When you go home, I would recommend that you take it easy for the day, okay? You must really have somebody with you, ideally for the next 24 hours. Manage your pain relief if you need it. That instructions will be in your discharge advice, but we recommend paracetamol. Monitor for any bleeding. Some spotting is normal. The things that we're worried about is any bright red heavy bleeding that is concerning you. You'll know the final egg count before you go, and that will also be updated in your portal message as well. If you're due to start any medication, so you might be due to start progesterone if you're due back in for fresh transfer, you'll get that instructions. Your medication calendar will be updated as well. I hope that that has made things maybe seem a little bit easier for you if you know what's ahead of you. It is an exciting day. It's what you've been working towards, but at the same time, probably one of the scarier parts of the process. Any concerns, please get in touch with the nurses. That's what we're here for. We want to make this easier for you. Best of luck.